Labour MP. Wes Streeting, good morning to you.
Good morning from sunny Salford.
Lovely. It's sunny everywhere at the moment, isn't it? Absolutely lovely. Let me ask you about something which is extraordinary that it's not on the front pages today. Junior doctors back on strike in the last half hour or so. Another 3-day strike. It's their third multiple-day strike, and we're looking at, pretty much half of the medical workforce of the NHS walking out. They want a 35% pay offer. They've been offered only 5%. This is waiting list now at 7.4 million. Remind me whose side Labour's on this week.
Well, we're on the side of patients, and we want the junior doctors to get a fair resolution to this dispute so that they're not forced out on strike. And I think the failure is the failure of the government to provide a table for the junior doctors to sit around and negotiate. If the Prime Minister can spend an hour with Boris Johnson talking about gongs and peerages for Conservative cronies, the least the Prime Minister can now do after more than 500,000 of delayed and cancelled operations is get around the table and grip this junior doctors dispute. And if he can't do it, then call in ACAS to mediate a resolution, because the longer this goes on, we've got junior doctors out on strike losing a day's pay every time they do, and you've got untold misery for patients with these delayed and cancelled operations that the NHS simply can't afford. So I want to see an end to this misery for everyone involved. The best way to do that is to get around the table and negotiate a resolution.
Absolutely, and it's going to be resolved at some point around the table. What is a fair resolution? This is the thing, because, 35% of 5%, there's quite a big gap there, and that gap would need to be filled, however big it is it's filled, by taxpayers' money. So most of whom we can see in the latest ONS figures, we're seeing 0.2% growth in GDP in April, but we saw yesterday wage figures say 2% fall in real terms in most people's wages on average over the last year, even though people have had around a 7% pay rise. I mean, what would be the fair resolution that you're looking at if you were in charge as Health Secretary?
Well, I think both the government and the BMA should try and negotiate across a whole range of issues. Pay, of course, is part of it.
Yeah, but what would that? Give me a number. Somewhere between 5% and 35%. What's the number?
Well,
because it's really easy to say, why don't they just resolve this? But if there isn't any money on the government side, i.e. taxpayers' money, and we've got massive debt and interest rates rising, and the doctor's saying we won't go for anything less than 35%, you can sit round a table and have as many bourbons dunked in your tea as you want. You're not going to get a resolution.
Well, I think you're right to point out that the state of the public finances and the weakness of the economy, thanks to the Conservatives, means that these sorts of talks are much harder, and resolving them has made that much more difficult. And it's one of the reasons, Julia, why I'm not plucking numbers out of thin air, but partly to reassure people about Labour's honesty and candour about the state of public finances and hard-headed realism about it. I have said that, in all honesty, we wouldn't be able to do 35% overnight.
What would you be able to do?
People can judge Labour on our record. When we were last in government, because we got the economy growing, NHS pay, in fact, pay right across the economy, rose. And in the case of the NHS, we were able not just to keep up in line with inflation, but to deliver pay restoration going back to when the Conservatives were.
Well, that's all very well, but I think last time you were in government, we hadn't just had a global pandemic, lockdowns, which, by the way, your party called for to be sooner, longer and deeper, and we didn't have a war in Europe. I mean, I'm thinking that maybe some of those things might have made a difference.
Well, I don't doubt that the Labour government would have had a challenging time dealing with those issues, but that doesn't explain why we went into the pandemic with NHS waiting lists already at a record 4.5 million and 100,000 staff shortages. So I am angry with the government. They didn't fix the roof while the sun was shining. They dismantled the roof and removed the floorboards, and we wonder why the NHS now struggles. And you've got NHS leaders out today saying, goodness me, it's hot, how are we going to cope? And in the winter, they'll be out saying, it's terrible seasonal flu. We're struggling to cope because the NHS has been disarmed over.
When was the sun shining in the wake of the economic crisis that was at the tail end of the last Labour government? Since when? When did the sun shine between 2008 and 2023? Because I don't remember when it did.
Well, it goes back to your point, Julia, about global events. We had to contend with that global event. Of course, it didn't stop the Tories then blaming Labour for what was a global event.
Well, there was deregulation of the banking system under Gordon Brown, which played its role.
We did deliver the shortest waiting times and the highest patient satisfaction in history, and the gap Inopportunities and achievement between kids from the wealthiest and poorest backgrounds begun to narrow. We lifted more than 1 million children out of poverty. We got the public transport infrastructure improving, trains running on time. I'm not saying it was the land of milk and honey and we got absolutely everything right and it's all perfect by the end. But goodness me, 13 years of Labour government looks a lot better compared to 13 years of Conservative
Apart from
government.
the small matter of an economic crash which put it into the doldrums for years. Right, let's talk about, though...
So I'm not Liz Truss, you can't blame me for that.
I think we can pretty much say that what happened in 2008 was rather more serious than what happened last summer.
I'm sorry, you're talking about a different...
No.
You're talking about the global one rather than the one that was made in Downing Street.
It's difficult to keep up. I do accept that. You mentioned the waiting list. Now you're announcing today that you want to use artificial intelligence to help slash record NHS waits. Now there's no doubt at all there is a massive admin issue, bureaucratic issue within the NHS. But how are you slashing waiting lists if you don't have enough doctors, radiologists, nurses, anaesthetists, you name it? There aren't enough people working in the NHS to carry out those roles. That's what we're constantly told, all those vacancies.
Yeah, and that's why we've committed to the biggest expansion of NHS staff in history, funded by abolishing the non-dom tax status. But whenever I've talked about that, people rightly say, oh, but it does take years to train new doctors and nurses. Of course, that's right. It's why the government should get its skates on. But it's also why we need to make sure we use technology and the revolution that's taking place, including in this country, where lots of these improvements are being discovered and the innovations are being created. We've got to use that technology as an enabler to make sure we can get more out of the staff who are already working in the system. We can't ask those people to slog their guts out any more than they are, but what we can do is give them the technology that speeds up what they're able to do and to take tasks off them. So, if you take breast cancer, for example, if we use AI in terms of breast cancer diagnosis, the cancer screening AI can cut radiologists' workload by up to 30%. It can improve detection of cancer, I think, by 13%. So better outcomes for patients, but also crucially, freeing up 30% of radiologist capacity, because you're right, there is a shortage of them. So if we can improve the outcomes for patients by using technology and free up radiologists' precious time, that's a win for everyone.
Yeah. Well, listen, if you can even just get people to send emails and phone messages rather than sending a letter which arrives the day after the appointment was due for, that would be a start. But look,
don't get me started on that. I mean, you're absolutely right, Julie. I was talking to a colleague yesterday who took her daughter in on day off school because she wasn't sure how long the appointment would last. Took her in for a face-to-face appointment as set out on the letter. And when she arrived, she was told it was meant to be a telephone appointment. I mean, people can see that the systems are inefficient. And, I'll tell you what, the people who complain loudest about the bureaucracy and inefficiency of the system are the poor people.
Yeah, well, maybe we should talk.
NHS.
Maybe the real conversation should be about NHS management. Let's also talk about the COVID inquiry. That began yesterday, and obviously a lot more focus on what happened in Nottingham yesterday than on what Baroness Hallett had to say. But we've seen reports, obviously, about what was said in the opening statements from the KC, Hugo Keith, for the inquiry. And he talked about how the UK was simply not prepared for a pandemic, and he talked about how very little thought had been given to the costs and the benefits of lockdowns, even the idea of lockdowns, which he is quite right about, and quite rightly there hadn't been because it was such a crazy thing to do. But he also talked about how Brexit had hindered preparations for the pandemic. Do you agree?
Well, I think we'll find out during the course of the inquiry, won't we? I do think the inquiry's got to look at all of the evidence in the cold light of day and give all of us the clarity of insight and analysis and evidence so we can think about how we would handle such an event again in the future. I dare say that there will be mistakes that government made that, frankly, any government would have made. There'll be some mistakes the government made that I think the government will have to take responsibility for. There'll be lots of things that government got right. And, of course, there'll be things that we as Parliament will want to reflect on as well, because, Labour sought throughout the pandemic to work as constructively as we could, holding the government to account, scrutinising decisions, which a responsible opposition should.
Now, you just called for more. Whatever it was, you just said, do more of it, please. Do it sooner and do it for longer.
Well,
hurt as much of the economy as you can, put as many people out of work as you can, and ruin as many people's lives as you can. That was all Labour demanded. There was no scrutiny.
I think that's a grossly unfair characterisation.
Tell me one time that Labour called for measures to be loosened. I don't know, maybe you had something to say about Scotch eggs in the pub, I don't know. But other than that, when?
Well, part of the argument we were making around lockdowns, and based on the advice we were receiving, was that faster action would actually lead to shorter lockdowns.
But there's no evidence for this. There's no evidence for this.
We will see. We'll see. We'll
New Zealand lockdown straight away, and and Australia, they were in lockdown for months and months and months.
Yeah, when I became the Shadow Health Secretary, I said in fact, immediately, I think, upon being appointed by Keir, that I didn't want to see our country in lockdown again. And but one thing I would say, Julia, and I think I speak for MPs right across the House of Commons unusually, we're not normally able to do that, given how divisive our politics can be at the moment. But look, those of us who voted to restrict people's liberties in the pursuit of public health and to try and not just protect the public, but to stop the health system from being overwhelmed, we didn't do it lightly. We really didn't. I hated lockdown. It was a miserable experience for all of us. And, I am anxious about the long-term impacts, not just on, jobs and livelihoods, but on children and young people in terms of their education, their health and well-being. We don't take any of this lightly. I think it's important that the inquiry is able to do its job, that we look at the conclusions, we take criticism on the chin, and we learn the right lessons.
Well, it's 3 years on. Maybe this lesson should have been learnt after the first lockdown. Just finally, I want to ask you, you mentioned about the Prime Minister having time to meet with Boris Johnson. This is all about the honours and what's going on there. Privileges Committee, we understand, are due to publish, they now expect to publish their report into whether or not the Prime Minister lied deliberately to Parliament about Partygate. We understand that they've concluded that he did, which is why he's resigned as an MP. They're due to publish on Thursday. The former Prime Minister Boris Johnson has said they should publish as soon as possible, and so they're allowing the world to judge their nonsense report and their absurdly unfair rules stopping even MPs criticising their findings. Should MPs be allowed to criticise the Privileges Committee and their findings?
Well, I mean, Boris Johnson has the luxury of not being an MP now because he's be able left. But look, we will ultimately see the report, and then it's for all of us as members of Parliament to consider it and vote on it, and members will be able to debate it. I think the sad thing for me is seeing a cross-party group of MPs maligned in terms of the way in which they've undertaken their job. I think all of them on that committee, Labour, Conservative, there are people of integrity.
Okay.
I think they will approach their work in a fair-minded way. We know what Boris Johnson thinks of it.
We certainly do. Wes Streeting, we'll have to leave it there. I know we're way over time. You've got another interview to get to. Shadow Health Secretary, Labour MP Wes Streeting. Thank you so much. This is Talk Breakfast.